Good afternoon, everyone. Thank you for joining us today on the Online Registration Made Easy webinar by Calvient. We are very happy that you joined us. We are recording this session, so if you have to leave early or if you want to pass this along to a colleague, you are welcome to do so. We will make those recordings available to you afterwards. Also, if you have any questions throughout the course of this presentation, please put them into the chat and someone on the Calvient team will make sure to answer those. I'll be going through this and I might not see your questions, so we'll make sure someone from the Calvient team sees those and we can get those addressed as we go. We want to start by talking about why having an online registration tool matters. This is a subject that comes up a lot, especially I think as younger patients are entering into the time of their life where they need healthcare and they're looking for providers and they're expecting the same level of access that they have for every other service. And so in modern America, people have become accustomed to having Netflix instead of going to the Blockbuster to rent a movie, or to being able to go online and do their banking online. And so the expectation of the modern consumer is to have the capability of completing their paperwork, to interact with health systems, with their providers in an electronic manner. And so that lays the foundation for why a lot of people start talking about paperless online registration. And that's what we want to talk about. We want to talk about having a module that is totally online, to where your patients don't have to come in and sit in the waiting room, fill out the paperwork, and that's manually incorporated back into your clinical system. So why does this matter? Well, it matters for your team because this can reduce the burden on your front office staff. This can also reduce the burden on your clinical staff, because a lot of the paperwork includes things like, what are your medications? What are your allergies? What is your surgical history? All of that does ultimately end back up with the clinical team. But it's also good for your patients. It simplifies the process for them, and it can reduce the amount of time they spend in the waiting room. Does this scenario sound familiar to you? I know it sounds familiar to me both as a patient and as a former healthcare professional. Your patient shows up 30 minutes early to complete the paperwork. Now, you're lucky if that's the case, because many times the patient may show up 5 minutes early. They may be coming from work. They may be coming from school. They may not be able to show up 30 minutes early and carve out that extra time in their day just to show up. But we advise our patients to show up 30 minutes early to complete their paperwork, to fill out a stack of sheets that you hand them on a clipboard. And then when they're done, they hand that back to the front office professional, where they will key that information into the system. They'll maybe scan their insurance cards. Maybe they'll take a picture of a photograph of the patient to put into Power Chart, and then they'll scan in relevant documents into the PM system. And then the patient goes back to the clinic room with the medical assistant, and the medical assistant will ask them, well, how tall are you? Well, that was probably written down on the piece of paper. They might ask them, have you had any updates to your medication since you were last seen? And so they're asking them verbally for questions they probably already filled out on the paperwork. And so a manual process both by the front office and by the clinical staff and by the patient. And so we're taking something here that could be done fully automated, and we're turning this into a very manual process that inconveniences the patient, the professional at check-in, and then the clinician, the medical assistant, and the nurse. Does that sound familiar? If that is a problem that is familiar to you as an organization, you are exactly who we want to talk to. We have a solution that addresses these particular problems that we know are challenging, not just because we've been patients, but because we've sat on the other side of that as healthcare professionals. So what if the patients could complete their paperwork from home? So the night before or 2 days before, they get an email or a text message reminding them of their visit. And on that message, there's a link saying, tap here to check in online. And just like you check in for a flight from home, you don't have to do that anymore, waiting in the long line at the airport. Or just like you can take care of your banking information from home, they can fill out all this information from home. And then with one click, that can be added back into Cerner by your registration and clinical teams. That's what we want to propose, to simplify this for the patient and to simplify this for your team, ultimately saving money and improving patient satisfaction. So what I want to do now is I'm going to change screens, and I'm going to share my screen and show how simple the online registration system is that Calvient has built. And I want to say a few things at the outset. This is a system that was designed to work for Cerner clients. And so if you are using Cerner at your organization, this system is designed for you. That sets us apart from a lot of other players in this space, because you'll come across a lot of online registration, patient engagement tools that will say we integrate with 50 different EHRs. And the reality is they don't really integrate with any of them, not in the way we're going to show you. So we want to show you how well our module sits inside of the Cerner ecosystem, keeping it incredibly simple for you and for your patients, and giving you the ultimate control and power to manage the system in the way that makes the most sense. I'm going to share my screen now, let you take a look at how this system works. All right, so we've stepped into the flow, and what's happened is we're in our staging system, and a patient has an appointment coming up on, let's say, Thursday of this week. They got a text message saying, "Hey, you've got paperwork to complete." They also got an email saying, "Your appointment's coming up. Click here to confirm, and click here to fill out your paperwork from home." And so we're sitting on a desktop. One thing to say at the outset: this application works just as well from a mobile phone as it does from a desktop. We're looking at the desktop view right now. So much of the information is completed because we already know this information about the patient. We're not going to ask them to write their name, first name, their sex, their date of birth. All of that information we have. You have it in Cerner. And so as a part of our integration, that's already filled out in as much as we want to configure that. So you have the option, and we'll show this in a moment, to configure which fields can pull forward automatically from the EHR and which ones have to be completed every time. So I'm going to scroll through this. Most of this has already been completed. You can see the green check mark saying it's completed. And all I would have to do is come in here and put in just what has changed since the last time I've been seen. So 123 test drive. May we contact you through email? Marital status hadn't pulled forward. Maybe we don't have that in the EHR. I'll change that to say that this patient's married. You can see these other fields are not required. You have the ability to control that, and we'll show that in a minute, but we'll skip them for now because we haven't required those. So we'll come to the insurance card screen. And do you have primary, secondary, and tertiary insurance? You can add as many of these as you need. I'm going to say no to secondary and tertiary and say yes to primary. Now you'll notice that this opens up a form that allows me to scan my insurance card. So I'm going to go ahead and click scan front of insurance card. It's going to say, "Can we use your camera?" And I'll say, "Yes, you can." And you'll see that my camera's pulled up. I've got a book right here that I'll place in front of the camera, and we'll put this in the viewport for the insurance card and take a picture. And then now that's going to go into Cerner. And I want to emphasize this. This goes directly into Cerner PM images or into the folder that you specify. And we'll show you how you do that. So there's no scanning in, there's no printing out, there's no running it through the scanner, manually filing it into the right chart. It's automatically going to go into the right place. Of course, I could do the same for the back of the insurance card. If I don't have a webcam, I can upload the card or I can key in this information. We are actually pairing with a company that will do an AI scan of your insurance card, pull that information off, and verify that the patient legitimately has that insurance, which of course is important for your eligibility checking. So I'll move on to the next screen. I'll sign this document. You have the ability to require physical signatures. You can disable that as needed. So I'll sign there and I'll click save and finish. Now this is going to right now produce these documents for the patient and interface them over into your system. Now I'm going to change screens here and go to what you will see as a registration professional. So this can work as an M page. If you're familiar with Cerner technology, this can actually sit inside of your EHR. So you don't have to log into Calvient's dashboard. You can actually see this inside of Cerner. And what you'll find is that patients that completed their paperwork, you'll see the paperwork completed over here on the right. So this particular test patient completed the patient demographics form. If I were to click on that, I could see the signed document. Furthermore, if I were to click on this row, I could send ad hoc any of these forms to the patient. Now, this is pretty powerful because let's say the patient shows up 20 minutes ahead of time and they have their phone and you don't want to hand them a clipboard. You could actually send them their paperwork and they can complete it from their phone in their vehicle. Let's say you don't want them in the waiting room or sitting in the waiting room. And when they sign it, all of that flows back into Cerner into the right place. So let's talk about how you manage this information. A part of the Calvient Autopilot or Calvient Channels platform is the ability that you have as a client to control all of this information, to configure all of this. So we mentioned earlier that some fields were not required. What if we wanted to make those fields required? Well, you can see that we have a registration section in our administrative panel. You can see all of the forms. You can build new ones. So let's say you have a new form coming along that you want to build. You can build it here, build each section, build each field. Let's say I wanted to take a particular field and I wanted to make it required. I could come here, find the field, and edit it. You can see that I could change it from not required to required. You'll see in the preview on the right-hand side that it shows how it's going to look when it's required. You can tell it, we want this to populate from the last time this form was submitted. So let's say the patient fills this out on their new patient paperwork and you want that answer to default on their next visit. On the next time they fill out paperwork, you can say, let this pull forward from the last submission and save that and make those updates. And then now if I were to go back and revisit this form, that section is now, that field is now required. You can also preview what the forms look like. So if I were to come to a particular section and edit that section, you can see what the form looks like on the right-hand side. So you can make changes, you can drag and drop, you can make edits, you can add fields to a given section and preview what those look like in real time so that you can test that, make those changes, and then push that out to your patients in real time. And as we mentioned, all of this is deeply integrated with Cerner. So this is where you would work with Calvient. This is where you would work with your IT team, and you could say this. You could create a field. You can say, let's grab phone number, home phone. And if I were to say I want home phone to map into Cerner, you can go select what Cerner field that maps to, and now that field that the patient fills out will post into Cerner at the right spot. Now you might be thinking, well, that's kind of dangerous. What if I don't want the patient to make direct updates into Cerner? What if they put some information that we want to screen and review before we add that information into Cerner? Well, that's precisely how our tool works. So let's talk about the integration between our platform and Cerner. When the patient fills out their paperwork, any PDF, so we're talking about the forms they sign it with their finger, it creates the document, or their demographics form, or anything you need to obtain signature on. Any of those PDFs will cross into the Cerner image repository automatically. There's no human intervention there. If they scan an insurance card front and back, primary, secondary, tertiary, if they take a photo that you wanted to post, let's say on the demographics banner, so you can have a photograph of the patient there when you open PowerChart, all of that will post automatically. Those are documents provided by the patient. It's just as if they were to hand them to you at the front office desk, you scan them and they go into the chart. However, discrete elements, so we're talking about an update to my address or an update to my cell phone or an update to my race or ethnicity, or let's say an update to my family history. I say my father developed COPD and we want to document that in family history, or I stopped drinking and I want that to reflect on my social history inside of Cerner. All of those will show up on a one-click screen for your team to look at that data, and with one click, they can add that into the chart, and then it goes into PowerChart automatically. Let's see how that looks. So the PDF form, these documents, they will interface directly and automatically into Cerner, no human intervention. When they show up at the desk, you will see their entrance card in Cerner. You'll see any documents that they create, that you've created for them and that they've signed. You'll see those in Cerner, no human intervention. But when it comes to particular information that they have, discrete information they have supplied that you want to update into Cerner, you will see this screen. You'll see here that this is an M page. You'll see this inside of PowerChart. So they walk up to the desk. You're on the registration dashboard that we showed a moment ago, and you click a window that opens this, and you can see that they submitted a new address. They submitted a new home phone, cell phone, or work phone, email address. They updated their language and their race and ethnicity. And with one click, you can add each section to Cerner, or you can click update all, and it will take those items and automatically update it inside of Cerner via direct integration. So there's no keying it in. There's the reduction in possible errors because this information is coming straight from the patient and it updates Cerner automatically. Now, what happens then after they're done with the front office and they're back in the room, they're being examined by the medical assistant, maybe they're being talked to by the physician or the nurse practitioner. Inside of Cerner, you'll be familiar with this view. This is a Cerner workflow M page that you have no doubt seen inside of your Cerner PowerChart environment. You'll have options such as load online data. If the patient filled out their data and completed it online, a button will appear for them and they can click load online data and it will automatically pull that data into the right spot in the chart. If it's social history, with one click, you can pull that data into the chart. If it's family history, their brother had a heart attack, maybe their mother passed away at age 92, and you want to pull that in, with one click, that pulls right in to the chart. So there is still a human that gets to review it to make sure that the information is correct, and with one click, that's pulled in. Furthermore, if you have the review of systems module turned on, which is included, you can go into the admin panel and turn that on, add it to any of the forms, and you can configure which sections appear. You can pull that data from online registration and it automatically fills out what the patient completed. Furthermore, because all of this information is in Cerner, this automatically can flow into the clinician's note via DyneDoc. In the particular screenshot you see, what the patient enters here shows up in the provider's note through DyneDoc. So no more is the provider having the patient fill it out on paper. And then when they're sitting in the room, you're asking them the million questions about their vitals, about their medical history, keying that into the chart, and then having to dictate that into the note through Dragon. That is fully automated. And with the providers we've worked with, this saves a tremendous amount of time, several minutes per visit for every patient who fills this out online. So this is a huge win, not just for the patient, but for the clinical staff as well. On the roadmap, future is insurance verification. I already mentioned we are working with an AI company to do insurance card processing. So it can scrub the insurance card, make sure it's a real insurance card, pull the data off, pull the copay off. That's already available to you. But in addition, we are adding insurance verification for all of your patients. If they key in what their insurance plan is, we can run that against an online database and verify that that's real. And along with that, on the roadmap is to add copay collection. So we can read that information back from the insurance company and let them pay their copay online to reduce even further what they are doing currently, standing in line at the front office desk. What's next? What next can you do? So if you've looked at this and you think, boy, I think this could be valuable for my organization, we can really simplify things for our patients. We can simplify things for our providers. Reach out to us at contact@calvient.com. We can complete a personalized demo for you. In fact, as a part of the onboarding process, when you sign with Calvient, you send us an email with all your paperwork and we will convert that to a digital format. You don't have to do that. We'll go in, we'll build your paperwork as you handed it to us into our system, and then you can go in and make updates. You can make changes. You can make optimizations as needed from that point on. But we'll take your paper copies, convert it to digital, and then we can send that to you so you can test those out and make sure that those are working for your organization. We will do the integration back into Cerner. So we'll make sure that we are having the documents flow over and interface into the right sections. We can do any type of workflow in-page optimization we have to do to make sure that those integrations that you saw in this demo are available to you. One thing I'll say, and if you were available at our online reminders webinar, we work exclusively with Cerner clients. What does that mean? Well, if you were to go to a generic big box online registration module, you would be thinking about a 6 to 12 month implementation cycle. And that's just talking about the interface work, the testing, getting everyone involved, working through your non-productions, going through multiple rounds of back and forth and testing, having to manually create these paper forms online. All of that is handled by Calvient, and we can do all of that in a matter of a few weeks. So you're not talking about a 6 to 12 month implementation cycle. You're talking about a 3 to 4 week implementation cycle from when we get your paperwork into when you can start testing it and selecting which physicians want to pilot it. If you would like access to our staging environment, if you say, I want to play around, I want to create some registration forms, I want to test what they look like when they're emailed to me, I want to test the reminder solution that I've just alluded to, email us at contact@calvient.com. We'll create you a profile in our staging system. You can log in, play around, see how this looks, see how this will work for your system. We're very confident that this is the best patient engagement module, both for reminders, which we've alluded to, and for registration that exists in the Cerner ecosystem. We're confident of that because we built it for Cerner clients. And so if you're a Cerner client, we invite you to reach out to us at contact@calvient.com. We'll do a personalized demo, do a deep dive into how this can revolutionize your practices. I do see we have a few questions. What operating system does Calvient support? Looks like we have that answered. Everything is web-based. So it will integrate inside of PowerChart through InPages. So if you're using PowerChart, if you're using any version of PowerChart since the year 2015, roughly, and beyond, since the 2015 certified EHR technology requirements, this will work just fine. It's supported on Internet Explorer, it's supported on Edge, it's supported on Chrome, Safari, iPhone, Android, Windows, everything. That's for your patients. And then for you, it's supported, of course, in PowerChart as well. It's a great question. It looks like Devin has posted some information about this in a blog on our website and invite you to that. Looks like we have another question. Do you create registration forms by specialty? The answer to that is yes. You can create as many registration forms as you need. In fact, I will share my screen and show how that works. so that you know I'm not just promising it. You can see exactly how that works inside of our platform. So you can create any number of resource groups. I can come here and say, we're going to create a cardiology specialty, let's say. And I'm going to add, I'll add a handful of our fake doctors. Again, this is our staging system. I'll add a handful of our fake doctors to that group. Or if you would prefer to do it by appointment type, you could do that as well. Let's say neurology. And we can come here and add neurology new. You can create an appointment type group for that. And then you can come down here and then you can assign a given form to a certain resource group. So I can say this new patient form only applies to the cardiology specialty at all locations and across all appointment types. So you can create an infinite number of forms by specialty. You can create different ones for new patients versus established patients. And you have total flexibility and control. That's a great question. I appreciate you asking that. Any other questions? I'm going to stop sharing my screen. Appreciate those questions. Appreciate you all being here. This is something we're very excited to partner with you all on. If you need any more information, again, reach out at contact@calvient.com. We'll get back with you. We will make this slide deck and this recording available to you. And again, if you want access to our staging system, we would be more than happy to give you a sign-on so you can get in there and see for yourself how this will revolutionize your front office and your clinical efficiency and provide patient satisfaction and satisfaction for your providers. Thank you again for joining. I'm going to stop the recording, and we really appreciate your time today.